for coming. Can everyone hear me okay in the back? I figured that our group's not going to be super big, so I'm not going to use a mic. So if you can't hear me, just raise your hand and I'll make sure that I speak louder, but just making sure that everyone can hear me. The topic of our lecture today is cash-based physical therapy. Okay, my name is Ron Miller. I'm the owner of Pursuit Physical Therapy. It's a 100% cash-based clinic here in Orlando, Florida. And then I also mentor other physical therapists with their cash-based clinics. And my website for that is cashbasedphysicaltherapy.org. And the two main objectives, I'm going to split my lecture into two sections. The first half of the lecture is going to be the current healthcare market and current trends that we can predict that's going to allow a cash-based physical therapy practice to thrive in the future of healthcare and the future of physical therapy. And then the second half of the lecture, I'm going to go over some basic fundamentals of business, okay? Business, marketing, and sales, okay? So I recently interviewed a former CEO of a rehab company, Jim Milton, Life Enhancing Therapies, and he said this: if you, being the newer PTs, don't stay proactive and adapt, you're going to get crushed. So I've been practicing for roughly 8 years now, and I'm one of the newer grads that have the student loan debt. So he was referring to me as a newer PT still, which I like that. That was kind of cool. But you know, if we don't stay proactive and adapt to the trends of healthcare and the economy, we're going to get crushed. So I'll tell you a little bit about myself real quick. So I will never forget this. The two things that made me want to open up a cash-based clinic, and I'm sure that I'll probably be able to relate with everyone here. I was treating patients. I was doing some manual therapy in an outpatient ortho practice. I had another patient beside me on a table, and I look up and my third patient's walking in the door. And I'm like, I knew that day I still could have helped that patient on my table, but because of the system and because of how things are set up, I couldn't do what's best for that patient anymore. So then it got me questioning, is there a better way? And then another time, I was showing decent outcomes. Physicians were referring to me at the time. This is when I was working for an ortho clinic. And my boss looked at me. I was getting people better in 2.5 units. My boss looked at me, who wasn't even a PT, said, Ron, you have to start charging 4 units a visit. And I was like, man, I'm done. I'm thinking of a new way now. So in 2013, I opened Pursuit Physical Therapy, decided to go straight cash. Yes, it was scary, you know, and it's a learning process of opening up a business because we're all PTs first. And then if you're in private practice, you're trying to be a businessman or a businesswoman or an entrepreneur. So it's scary at first, but now I'm in my 4th year. It's thriving. I expanded. I'm hiring PTs now. We're projected to do $225,000 of revenue, all cash this year, with very low overhead, and my projections for next year are almost $300,000 in sales, all cash. So I'm going to tell you a little bit about how my clinic's thriving and what the future holds for us, and some essential business fundamentals that you guys can take with you if you're a private practice owner who wants to expand into some cash services, or whether you're a new grad thinking about opening a cash-based clinic, or you're a DPT student or a PTA student who wants to go into a cash-based clinic. So you'll be able to take some things from this. So I like to operate by the KISS principle, okay? Keep it simple, stupid. Okay, keep things simple, and things don't have to be harder than what they have to be. So as we go through some economy things, I just like to keep things simple. Keep it fundamental and simple so you guys get the point. And just like Einstein said, everything should be made as simple as possible, but never simpler. So right now, how many private practice owners are there? Good. How many students are there right now? Good. How many people who are interested in opening a cash-based clinic? Very good, nice. Okay, so right now, in the current state of healthcare and the current economy, who would want to open up a cash-based clinic right now? A lot of us are probably scared. A lot of us don't know what to do. Some people are like, I don't know how to do it because we're not taught business in school. But that's a good question. Right now, in the current state, who wants to open up a cash-based clinic right now? It sounds good, but we'll see what happens. So throughout this lecture, I'm going to be quoting a lot of entrepreneurs and CEOs, and I'll break that fundamental principle down. So I was in Silicon Valley at a tech conference, and I ran into Mark Zuckerberg, and I asked him a question about business and what it takes to start out a business. And he said, when starting out, it's good to first look at what problem are you solving in the world, okay? So if you're gonna open up a business or a cash-based physical therapy practice, which is a small business, what problem are we solving, okay? We need to identify that first. So look at Uber, saving time, convenience, solving the problem of a dirty taxi cab that's running late, and creating a better experience where I can see the car coming to me right now on my app. It's cheaper, more effective. No one likes to go to the store anymore. Rather yet, I can click a button and order it, and the product gets dropped off at my door. What a great problem that Amazon's solving. How about people don't want to pay for overpriced hotel rooms sometimes, or the increased expenses at a hotel. And better yet, the homeowners who have extra rooms can generate revenue now. What a great idea. What a great problem Airbnb is solving. What about every time I go to the beach, my drink never stays cold? Yeti solved that problem. I love Yetis. That's probably the best invention since probably the iPad. I love Yetis. What about washing the dishes with a sponge? This is a multi-million-dollar company from Shark Tank. All they did is create a better sponge with a smiley face on it. And it's a multi-million-dollar company solving simple problems sometimes. What about Netflix? If cable TV doesn't adapt, they're gonna lose. So Netflix, I don't wanna watch commercials anymore. If I wanna watch the whole season, I want the whole season right in front of me to be able to click through. I don't wanna wait week to week to week anymore. I wanna be able to choose what I wanna watch and not pay for the other channels that I never watch. Netflix is brilliant, solving problems. Tesla, multi-level company, solving problems, carbon dioxide, electric cars, solar panels, power walls. Elon Musk is drilling tunnels underneath LA right now to solve the traffic problem in LA. So brilliant entrepreneur minds solving problems. So the question is, what problems are we solving as physical therapists interested in opening a cash-based clinic? So we know that the healthcare system is dysfunctional. There's so many problems in it, okay? We could spend a whole 2 hours talking about the problems in healthcare, but we only have 2 hours here today to talk about everything. So I want everyone to take off your physical therapy hats, and I want you to put on your business owner hats or your entrepreneur hats. And let's take a step back, not think about this from a physical therapist perspective, but an entrepreneur perspective. What if we in this room were challenged with, let's solve the problems in healthcare from not a physical therapy, narrow-minded, biased opinion, but through all of healthcare, okay? And we'll take each step through, and we're gonna break down the problems of healthcare with the system, healthcare economics, insurance companies, break it into the clinician. What problems do we have as clinicians in the current system, and what are our patients complaining about, okay? So we're gonna solve the problem in healthcare today in a matter of a half hour. So we all know that the relationships between the insurance companies, patients, and the clinician, it is a dysfunctional relationship. I mean, what kind of business you provide services and you bill for $100, but you don't get paid until a couple months later and maybe $50. I mean, it's a horrible business model. How many patients pay for health insurance but have no clue what it covers? And they don't understand what a deductible is, and they don't understand what a copay is, or even a co-insurance. So this is a dysfunctional relationship. And not even just healthcare. I'm sure many people with insurance in general have ran into huge problems with, like the hurricane, with homeowners insurance. You pay this money every month to have insurance, but when you submit a claim after like the hurricane came, the insurance role now is to undermine that, deny it, or pay you the lowest amount possible. That's a problem. So it's not just healthcare. Whether it's disability insurance, you paid your premiums every month for years, and now it's time for you to make a claim, something unfortunately happened, and now the insurance is trying to deny it or lowball it, say, no, it's really not that serious. That's a problem. Okay, so this relationship here is, we have to solve this. We need to get on the same page. And the unfortunate thing about all this, whether it's health insurance, whether it's homeowners insurance, whether it's disability insurance, the person that suffers is the patient or the client. So we have to solve this, okay? So let's look at the healthcare system in general really quick and highlight some points, okay? What are some of the problems in healthcare? The increase in cost of healthcare. The cost of healthcare is going up, okay? If an eval costs $150, a hospital system is allowed to bill 5 times the amount that, why is it inflated like that? Why are they allowed to do that? So the increase in cost of healthcare is going up. It's a horrible business model. Someone provides the services, for example, a hospital may bill $18 billion for medical services and they may get 6. If we bill $150, we may get 75 back. That's a problem right there. Okay, it's a bad business model. There's a reason why Shark Tank doesn't allow healthcare businesses on Shark Tank. So we have a population that's increasing disease rates. So there's a bigger need in healthcare, whether it's just physical therapy, musculoskeletal injuries, neuropediatrics, whatever. There's an increasing disease rates in our society. So there's an increased need for services. Okay. Another problem is how to cover the poor. Medicaid programs and stuff like that. Not to mention Medicare is a broken system, Keep it simple. The amount of money coming into the Medicare system is lower than the amount of money that's going out. That system cannot function at that current rate. That's a problem that has to be solved, okay? That's bad business. And if that keeps going on, something's gonna happen. It's called going out of business. It's a reactive model. It's service-based. Okay, the more that we bill, the longer we see the patient, the more money in standard healthcare in an insurance model, the more money comes in. So that's good. That's for business-wise, but that's not a good healthcare model. The longer I treat the patient, the more services I do, the more I bill, the more money that comes in to the clinic. That's not doing best practice. That's more of reactive model. I love the functional medicine approach where now physicians are going towards, or many new ones are going towards functional medicine. Say you have a patient with hypertension. You don't get treated with medications anymore. You go back the other way. What are the risk factors? What's causing the hypertension? Food allergies, toxicity levels, look at homocysteine levels, doing blood work, looking at the root cause of why this patient has hypertension instead of just treating with a pill or covering up symptoms. I love that approach, and that's where healthcare has to go. We have to solve the root cause of our patients' problems. So let's look at it from a provider or a clinician. As clinicians, what problems do we have? Declining reimbursement. Okay, we all know that's going on. We're getting paid less and less for the services that we provide. The healthcare system, again, the expenses are going up, the amount of money coming in is low. That's a problem. So what they're doing is declining reimbursement. It's not just us either as physical therapists, it's physicians, everyone across the board. We're forced to see more patients per hour. So our productivity standards in standard healthcare are going up. And some of the clinics, it's kind of insane. They almost make you see 100% productivity. I don't know how you do that, but sometimes you're treating patients and documenting at the same time. Just keep doing that exercise, keep going, yeah. What kind of care is that? So now as a clinician, you're forced to see more patients per hour. I remember when I was in a residency, I was shadowing physicians. It was unbelievable. There was like 5 different rooms and walked in and out. Surgery, injections, PT. Okay, come back out, surgery, injections, PT. He was seeing like so many patients per hour, it was insane. I would love to see the numbers of how much he got paid for that. But so productivity and standards are going way up as a clinician, and we're forced to be overworked now. Too many unnecessary procedures. Again, it's a balance between business and productivity. I understand in standard healthcare, you have to get your average reimbursement per patient up. So what you do is add on a stim and ultrasound, add on a stim and hot pack, add on unnecessary procedures. Okay, I understand why that, but as a provider, as a business owner, you have to do that to keep your average revenue per patient up. Insurance and guidelines dictate treatment, okay? Not us. So what's unbelievable about this, so my family and my staff, we have a health share. We're not with health insurance. And they are very proactive. They're very cost effective too. And they see the value in having direct primary care services. They actually pay me to be a member of a direct primary care model, okay? And they used to cover 20 visits a year for physiotherapy. Now, they even cut off physiotherapy. They don't even see the benefit of physiotherapy. They cut physiotherapy visits to 10 visits a year. And now, if I want physiotherapy, you have to send the eval in. A nurse dictates how many visits you're actually approved for. A nurse who has no training in what I do. She probably couldn't even read the eval of all my writing and documentation. And then the nurse dictates the care for the patient, not me. So the fact that insurance guidelines and insurance companies dictating treatment, not doing what's best for the patient, again, that's a problem. We should be dictating care what's best for our patients. Avoiding harm and poor outcomes. I don't understand how medical errors is the third leading cause of death in the US still. That is like flabbergasting to me. I don't understand that. How is medical errors the third leading cause of death still? So increases expenses, the cost of care is going up. All of medicine is lacking cost-effective treatments. Again, it's a balance between the business side versus what's best practice, what's evidence-based. You know, there's a lack of cost-effective treatments. So let's look at it from the patient's perspective. What are the patients saying about healthcare? Health insurance costs too much. The cost of healthcare and treatment is too much. Whenever I have to go and actually get treatment, they're like, I don't want to pay $200 for an eval. Deductibles are too high. Most patients don't even know what a deductible is, and when they go and seek healthcare, they're like, well, I have to pay $5,000 for this? They don't even know what a deductible is. Or they complain that my doctor takes too much, my doctor doesn't take my health insurance. There's long waiting periods, whether it's just to wait 2 or 3 weeks to get in to see the clinician, or whether it's waiting for 45 minutes after your appointment schedule. That's a problem in many clinics, not just physiotherapy places, but even physician offices. And a lot of patients don't want to be a part of a factory setting, getting double and triple booked with other patients. This is really important to find out what the patients are telling us, because they're going to tell us the problems and it's up to us to solve it. So in my cash-based clinic, what do a lot of my patients say? The physician saw me for 5 minutes and I walked into the clinic with low back pain. He told me I have low back pain and I walked out of the clinic. And he didn't even touch me, didn't even do an eval, just talked to me and that was it for 5 minutes. Doctor evals with just questions, no actual physical eval. A lot of patients complain that they're triple booked with other patients. I see a lot of complex cases that failed standard care, whether it's PT, chiro, physician injections, nerve ablations. I see a lot of complex cases at my clinic. A lot of patients say that treatment didn't help. Everyone was nice, but the treatment didn't work. The physician just wanted to do surgery. They go to get a surgeon's opinion, they have a herniated disc in their back, and all of a sudden the surgeon wants to do surgery, and they don't want surgery. It may or may not be the best option for them. I had 3 injections and the injections failed. I'm a CrossFitter and they just told me to stop doing CrossFit, or I'm a runner and the clinician just told me to stop running. So the big problem in healthcare is, can we deliver high quality healthcare to all Americans at an affordable price? Okay? And what has to change? We have to have an effective model. Us as a whole, PTs and all of medicine, we do have to decrease the cost of healthcare. Hospitals and clinics need to reduce the overall costs and expenses. Okay? Healthcare providers have to reduce the cost per patient and make things cost effective. Clinicians, PTs, and everyone else, we need to be more innovative and cost effective how care is given. Overall, healthcare services has to be more efficient, more innovative, and in more of a cost effective manner. So out of all the problems that we just listed, what solutions can a cash-based physiotherapy practice provide out of all those problems. Because again, if you're going to open up a cash-based clinic, you better know what problems that you're going to solve. So insurance, we can decrease the cost of care. In a cash-based clinic, if you don't get the patient better, they're not going to pay you cash. So outcomes is going to dictate, or your system is built based on your results. Plain and simple. If you're not getting the patient better, they're not going to come in and pay cash for it. As a clinician, you can maintain high-quality one-on-one care. No one's going to pay you cash if you're double and triple booking them with other patients. They're not going to pay that. What is best for the patient dictates treatment in a cash-based clinic. Okay, so the patient and the values and the outcome of the patient is placed first, and everything else comes after that. What do the patients say? They have direct access. There's no waiting periods. You know, your overhead's going to be low. It's a smaller clinic at first. There is no waiting periods. I think the average wait time at my clinic is 3 to 5 minutes whenever someone comes in. You increase patient satisfaction. You can have a one-on-one relationship with the patient again. Okay, so patient satisfaction, and the cost of care is cheaper. And you're probably asking me, Ron, do you have any evidence to actually support this? Right now, I'm teaming up with the University of Central Florida. I'm publishing my 3-year data to show the cost effectiveness of a cash-based clinic. So if you look at some of the Fritz studies, and we just take lower back pain, for example, we know the average cost of a case of lower back pain is $1,800 to $6,600. In 2016, my low back pain cases, the average cost was $805. And I'm not just seeing super rich people who just want to get better in easy cases. I'm seeing a lot of the complex cases where people actually pay $3,000 to get their back pain treated. So I'm not just seeing easy athletes, wealthy people who just are motivated to get better. I'm also seeing the cases that failed treatment. So my average cost of low back pain was $805. So we're in the process of publishing that, and for some reason, I don't know why health insurances still don't see the value in what we do, not just results-wise, but outcome-wise and cost-effectiveness. There's one study, the RAND study from 71 to 82, that further supports how cost-effective a cash-based model can be. They pretty much looked at 2,700 families under the age of 65. They randomly were assigned into 5 health insurance plans. One was free, 25% cost sharing, 50% cost sharing, 95% cost sharing, and an HMO free care. The results showed participants who paid for their share of health care used fewer health services in comparison to the free group. Cost sharing reduced the use of services. Cost sharing did not significantly affect the quality of care given, and cost sharing in general had no adverse effects. So this is a newer concept now, but there was one old study performed, and that just highlights the importance and the value that if the patient has to pay for services, that there are some legit research studies that show it is cost effective. Still good outcomes are reached, and there's no adverse effects until my 3-year study comes out. So I was at a Tony Robbins seminar, and he had me take off my shoes, and he told me to walk across this burning hot coal, and then he'd tell me this business knowledge and give me some ideas for a business. So I ran across the thing with hot coal, and my feet were burning, and then he told me some his business success stories, and he told me this: if you're going to start a business out or a cash-based clinic, businesses succeed in a free market by providing a product or service that others want, and it meets the needs of others. Okay, so if you're going to open up a cash-based physical therapy practice, which that means you're a small business owner, you have to meet the needs and want of your target audience. Okay. So Scrub Daddy met the need. People wanted a good sponge to wash dishes with. Better yet, they want to see a happy face on it. Okay, it's meeting the needs of the consumer. People wanted their drinks to stay cold. Yeti solved that problem. People want that. Okay, most people just think of a cash-based system and they're like, oh no, it doesn't work. I bet you the person who designed the first private school system, when education's free, is like, I think I'm going to start a private school. And I'm sure everyone was like, no way, no one's going to pay for school when you can just go right here and get it for free. So I'm sure we're in that same boat there. Some other examples of change in times. If cable television doesn't adapt, we may not have cable TV anymore. Who watched the World Series? All over the background is YouTube TV. YouTube's creating a TV station now. Live streaming directly to you. You can customize and pick whatever you want to watch. Netflix is doing the same thing. The education system, so some of these current problems and current needs and wants, we have to start fixing these things with the education problem too. Someone during the Oxford debate brought a great point out about our PT education system. Are we not setting our new grads and PT students up for success straight out of school? Why is that even a problem? Why do we have to try to force someone to do a residency now just to get good? So they brought up a really good topic. Does our education system have to change? Does our DPT programs have to change to better equip our new grads to a changing healthcare environment? So what do our prospective patients need and want? Okay? What do they need? They need a decreased cost of care. They need easy access. We have direct access in Florida, and most states do have direct access for physical therapy in the US. We need successful outcomes. Okay? The patients need evidence-based and proven treatment approaches that can get patients better in fewer visits at a cheaper cost. That's what they need. What do the patients want? If you know directly what your prospective patients want, you can solve all of these problems and make it happen in a cash-based setting. So the patient wants a great patient experience. They want to see the best. Okay? They want to see the expert. They want to get pain-free. They want faster results and fewer visits. They want it to be cost-effective at a cheaper cost. Okay? They want one-on-one patient care. Okay, so right here we can solve these problems. If you're interested in opening a cash-based clinic, you should have an answer to all of these, and you know exactly what your patient wants. So now let's talk about prognosis or prediction. Okay, I'm sure that we've all seen this quote because if you want to be successful in business, you have to know where you're going. Okay. Wayne Gretzky said a great quote when he was asked, you weren't the fastest player, you weren't the biggest player, you're not the strongest player, but still you're considered one of the greatest hockey players of all time. Why? And his answer was, most players skate to where the puck is, and I skate to where the puck is going. So if you're going to open up a cash-based clinic, are you just sitting in this current environment and current healthcare trying to run a business, or are you predicting the future of healthcare and where it's going and striving towards that to have a successful business? Because just because you open up a business doesn't mean you're going to be successful. So another example of prognosis, this is back in the 90s when I was in college, and I just imagine 10 guys sitting around, and we look over and one of my friends is reading a Cosmopolitan, and we're like, dude, why are you reading a Cosmopolitan? And he looks up and is like, it's like reading the other team's playbook. I'll know exactly what girls are thinking so I can get more girls. It was like ridiculous at the time. We're like, what? But then you think about it, he's reading the other team's playbook. He's predicting, he knows what's going to happen. If you knew what, if you could predict the housing market crash, you could be able to make better decisions and not buy a house or choose to invest in a house at that time. If you could imagine the value of prognosis or prediction if you could predict the stock market. Imagine with a patient sitting in front of you, if they present with certain factors and the research supports this to predict a good or bad outcome. Okay, it's evidence-based practice. What if you could predict the future of healthcare and the current environment of what's going to happen to allow you to be set up for success in a cash-based model? And we're going to tell you right now exactly what's going on. We're going to break down the economy. We're going to look at the service industry because we're in the service industry. It's just healthcare and service. We're going to look at healthcare trends, the marketplace, and how to create real value. Everyone says you have to create value in the patient's eyes, but I'll show you exactly what value means. Everyone always says you have to create value. Okay, economic trends. Peter Drucker, we're in the era of 3 C's. Accelerated change, increased complexity, increased competition. Healthcare in general is an oversaturated market. PT is an oversaturated market. There's PT clinics everywhere. There's chiro clinics everywhere. Okay, Eric Worre, wrote GoPro. We're in a performance-based economy now. This is a new economy. What does he mean by this? We're going through the biggest economic shift of our lifetime, the new economy. The corporate era is done. No more you're just going to school, working for a company, getting paid a salary with benefits, working for years, you save, you retire, you work more, you save, retire. It's not going to happen anymore. I think my generation and below is going to have a huge retirement problem because we're not saving. Okay? We're in a performance economy now. What does this mean? You're going to be paid for performance and results all across the board, not just healthcare. And an example of this is like the servers. Servers get paid a low salary, and based on their performance on tips, that dictates their salary. You know, say if you're running a hotel, you're not going to pay the maintenance crew or the cleaning crew based on time. You're going to pay them based on the number of rooms they cleaned. Okay? Some of you may even have seen this already with your clinics. Productivity standards are going way up. Maybe you're forced to see 8 to 12 patients a day, but now they're not going to pay you for overtime, and now you're just getting a fixed salary. Okay? So this is coming. Okay? Why is this coming? As a business owner, it's a better improved model for businesses and companies. The new economy is going to need less people. Technology is going to replace a lot of jobs. So I don't need to hire staff. You know, right now I'm trying to replace my receptionist with technology. I don't need that increased expense. There's going to be less business expenses. The key with any business, especially a cash-based business, is to keep your overhead low. You have to keep your overhead low. That means keeping your expenses down, especially whenever you start out. You're going to have better results and increased production because I'm only going to pay the person on the number of rooms they clean. Or with my physiotherapists, they only get paid based on the results and the amount of revenue they bring in. It's not an hourly rate. But if my therapist brings more money in to the pot and Pursuit's making profit, they get a reward for that. They're incentivized based off of revenue, not just hours worked. Okay, it's a new model occurring. There's an exponential rise of technology, all based on outcomes. And many physiotherapy clinics, hospital clinics have already been adapting to this. You're going to be paid based on performance now, not time worked. Okay, technology and mass information. If you don't know who Gary Vee is, he talked at the PPS conference a couple years back. Awesome stuff. He's really doing some great stuff for entrepreneurs and small business owners. We're in the age of technology and mass information. Value, if you can bundle the right information, there's value in that, and package it. How many patients come in and said that I have low back pain? I was Googling low back pain and how to treat it and stuff like that. Everyone refers to Google Doctor. You know, that they're in pain and they start searching on Google for how to resolve their pain. Hint, that's telling you something. As a business owner, if you're not on Google and your information is not popping up, you need to start doing that at a cash-based clinic. But almost 90% of the information on Google's garbage. Anyone can write a blog post now. Anyone can create a editorial now. So you know, the only problem with this is that the quality of the information is bad.